Cancer diagnosis is a challenging journey, and it's understandable to seek all available options for healing. I get that. And as a doc, I too want to know what else might be out there. We're all looking for ways to better treat cancer. The truth is, however, Dr. Google floods us with miracle cures that often lack any evidence and may even be harmful. So today, we're going to dive into integrative therapies and separate fact from fiction. We'll get advice from world experts who dedicate their lives to testing and prescribing integrative approaches to help our patients. Hello, I'm Dr. Diane Reidy-Lagunes from Memorial Sloan Kettering Cancer Center, and welcome to Cancer Straight Talk. We're bringing together national experts and patients fighting these diseases to have evidence-based conversations. Our mission is to educate and empower you and your family members to make the right decisions and live happier and healthier lives. For more information on the topics discussed here or to send us your questions, please visit us at mskcc.org/podcast. Today, we are thrilled to be joined by Dr. Jun Mao, the chief of MSK's Integrative Medical Service. Dr. Mao combines Eastern and Western approaches to help patients manage symptoms that may arise from the conventional chemotherapy treatments, which include pain, fatigue, insomnia, hot flashes, anxiety, and depression. And here's a fun fact. MSK started its integrative medicine service back in 1999, and it was the first integrative oncology program in the country. It was built on the premise that healing cancer goes way beyond standard medical treatments, and promoting wellness in the mind, body, and spirit are critically important. We're also joined today by Jason Hou, who is an herbalist and acupuncturist here at MSK. Jason will share his expertise on the role that herbs and supplements can play in cancer treatment. Jason and Jun, thank you so much for joining us today. Jun, if we could just start off, can you define for us what integrative medicine actually is and how these therapies can help our patients?
To a lot of patients and families, the term can be very confusing. I think the term the public knows more is called alternative medicine. So let me start with the definition. Alternative medicine is using therapeutic approach instead of a conventional treatment such as chemotherapy and surgery and radiation. So what integrative medicine, on the other hand, is to bring therapies and practices from other culture and traditions such as acupuncture, mindfulness, yoga, herbal supplements, and lifestyle modifications such as exercise, stress management, sleep management, diet, together with conventional oncological treatment to help patients feel empowered to be active participants during and beyond cancer treatment. So the major differentiator is to use in a synergistic way rather than choosing alternative medicine and forego conventional treatment.
So I know firsthand how you've helped my patients with symptoms that arise from either the treatments and or the disease. So can you explain how one might approach, as a physician like yourself, these types of integrative therapies for different types of patients?
I do think integrative medicine helps patients in several ways. In terms of the symptoms, we now have evidence-based interventions backed by randomized clinical trials for specific symptom management. For example, acupuncture and massage can be utilized for pain management during cancer treatment as well as in palliative care or in survivorship. Exercise, yoga, or Tai Chi can really help patients to reduce their fatigue during treatment in survivorship. Cancer can cause a lot of psychological distress such as anxiety, depression, worry, fear of recurrence. Therapies like mindfulness, well, music therapy can be incredibly powerful. So as a physician, I, first of all, listen to patients' story, understand their needs, and also what they prefer to do. Then work with them to really incorporate their preference to formulate a plan that is right for that individual. I'm sure a lot of patients, probably you feel this profound loss of control. But with the integrated approach, a lot of the options we have, they can choose. They're actually engaging that decision-making. So by participating into integrated care, we hope to return some of that level of control back to our patients.
I love it. When you think about prescribing these different types of integrative approaches to the patient, does that tend to be symptom-specific disease specific or both?
When we think about integrated approach, we look at three major things from a medical decision perspective. Number one is the symptoms. The second is the specific type of disease. There's certain disease like breast cancer, ovarian cancer are very hormonal driven. So we need to be careful about hormonal inducing herbs and supplements. And then there are certain diseases like a GI cancers tend to have, weight loss, poor appetite, nausea, vomiting. Those things are particularly profound in those type of cancers. So we really try to work with them on diet to allow them to maintain their weight and have appetite. And then also, I think another key factor driving the decision making is the treatment phase. So for early stage cancer, when curative treatment is very evidence-based for oncological treatment, we need to really prioritize that. And then in the context of survivorship, a lot of people don't want to add another pill to manage their symptoms. They feel like, gosh, I'm taking this pill. Yes, it helped me with this problem, then give me side effect of two other problems. I need to take two other pills. So they want something more non-pharmacological, right? And then also we're dealing with people living with advanced cancer, maybe close into end of life. In that setting, the lines of chemotherapy are even exhausted. So we really work with family and patient to understand what are important to you, what are the goals for your care, like really to design the treatment that is appropriate for them.
That's right. So along those lines, your team really helps us take care of a patient as a whole. And I think some of the symptoms that you really try to address, including mind-body, is so critically important. But that treating of the cancer is clearly one that our patients are most concerned about at times. So can you talk to us a little bit about preventing it from recurrence and or treating it as sort of an anti-cancer therapy treatment?
When we think about treating cancer, what is really the goal of that treating cancer is to live better quality of life for a longer period of time, right? With that goal, if we can use appropriate integrative therapy like exercise, mindfulness to allow you to mitigate side effects of the treatment, then you can tolerate the cancer treatment better. Then eventually you will have better quality of life and the longevity of life. But to envision the therapies we do to target the cancer cells specifically, unfortunately, the data is just not there. We don't have good, high quality clinical trial. So we have to just be very clear about where the evidence is and where the evidence not. So I don't think the evidence for integrative therapy is treating cancer as a biological disease, but where the evidence is incorporated is together with conventional oncological treatment, we can improve the quality of life and potentially the longevity of life.
Yeah, I think that's so critically important. And I've heard you speak a lot about, in addition to managing those symptoms and trying to lower stress, the power of human connection is one that hard to do a study on that, but probably does have something there too that I think is really fascinating. And so can you talk to us a little bit about the role of mental health, lowering stress, and how integrative medicine may be a solution for that, particularly for some of our patients that may not have integrative therapies at their hospitals?
Yeah, there is actually observational studies looking at things like a social connectivity or loneliness as a factor associated with poor outcomes. And we are actually studying this in the context of clinical trials with some of the program we do. One of the key factors is trying to connect people, connect the community of cancer patients and cancer survivor to support one another and also be supported by their extended network. So during our integrated medicine consultation, I always ask the patient, like, what is your family situation? What's your social network? Do you feel like you're getting adequate support in that way? So the range of responses really vary. So I think as a health system and the society, we need to figure out a better way to support patients beyond the walls of the hospital and to really use a variety of other social or religious or other programs to really help people to feel they are going through this horrible disease with the people love and support around them.
So, Jason, I do want to talk about alternative approaches, if you will, because I get asked this every single day. Our patients just want to know there are a lot of popular alternative therapies out there. So, if you don't mind, we're just going to go through them. Let's start with ivermectin. What is it and does it help treat cancer?
So
Ivermectin is actually a anti-parasitic. It actually has a Nobel Prize. But in terms of ivermectin for treating cancer, right now we just cannot say that this drug can treat cancer.
So, a great drug to treat parasites, but not for cancer. What about cannabis oil?
Cannabis oils. It's often referred as the Rick Simpson's oil. So it's highly concentrated oil, but no, it's only anecdotal. Some may benefit from just rubbing oil on the lesion, but it's very controversial. And we even got another oil that National Geographic approached Dr. Mao to say whether castor oil has any effect on breast cancer, because on TikTok, this viral video that says just by rubbing on the lesion, you can cure the breast cancer. And National Geographic had to quickly come to Dr. Mao and say, hey, is there any truth to this? Same thing. We had to quickly go through all the public literatures, see if there's any clinical studies, and then the result come back, there's no evidence to support castor oil curing any cancer.
Yeah, and I love how you said that. We're just not naysayers and saying don't even think about it. You're dedicating your lives to try to explore these therapies and options and looking at the best available data. It's just not there.
Some of these therapy are very cultural, so they might have been passed down from generations. Maybe there's some science to it that we still haven't explored. So I always have to go back to the literature and see if there's any study relevant to this particular herb in cancer. And we publish it.
In fact, there was a recent study that suggested that the combination of cannabis oil and immunotherapy may not be so good. So in patients that are on immunotherapy and also taking cannabis, that immune response may have been blunted. And so I think that's critically important because immunotherapy may be life-saving for many different types of cancers. What about high-dose vitamin C?
That's also a very controversial topic. So when you're vitamin C deficient, you get scurvy, and we use vitamin C as anti-scurvy. But to have it in high dose and intravenously administered, it works in a different way. So right now, I think there's a few studies going on, but we just don't have evidence to support what population high-dose vitamin C works in. So until then, we're going to say no to vitamin C.
Yeah, I think that's right. And I think for our listeners, there was a very small study in a very small journal on the role of vitamin C plus chemotherapy for pancreas cancer. And although the results looked positive and it got a lot of press, there were a lot of major flaws with that study. And so, again, it's not that we don't want to give vitamin C out to all of our patients, but there were so many problems with that study that most of us don't feel comfortable saying that, in fact, the data itself was exciting enough to do something different or make it practice changing.
And also, things like high-dose vitamin C are not new, right? It's not something so obscure you couldn't develop a formulation. So the fact is, like, we haven't really seen any convincing data beyond the just anecdote. And it's not cheap. Like when patients paying out of pocket for those type of therapies, it's not cheap.
No, it's not. And I'm very glad we're talking about it because the reality is people are doing that. And for some, they may be blessed to be able to afford it, but others can't. And I think that if the data were there, I think that there would be more excitement about it. I think there are other studies as well with other types of vitamins. It actually made it worse. So these drugs, by definition, people think that they, quote, go to the immune system, but they can actually go to the cancer as well, right? The cancer cells are the ones that are often taking up these nutrients in a faster way than our normal cells. So I think, again, that's sort of just with caution. We just don't have enough data. What about turmeric?
It's also a very cultural remedy. When I hear turmeric, my family yank it out from the ground. We wash it, we dice it, we cook it with fish, and we drink it as a soup. It's good for GI, it's good for anti-inflammatory. But in the US, it's in a capsule. There are studies in the anti-inflammatory realm, but with regards to cancer, we don't know. So I guess as a food, yes, but as a high-dose supplement, maybe for anti-inflammatory, aches and pains, but not for cancer, not to treat cancer.
What about medicinal mushrooms like turkey tail and lion's mane?
Yeah, so they're a form of fiber. So it cannot directly kill cancer, but we have study that shows potentially that it can basically awaken the immune cells and actively gobble up the harmful bacteria, viruses and potentially cancer cells. It kind of activates what immune system you have in the body to look for cancer cells and kill them.
Great. And then lastly, ashwagandha. That's a hot one.
So it's Ayurvedic, same with turmeric. So there's some study regarding how it can relieve stress. So it can help lower the cortisol level. So it helps kind of calm you down. But as far as to kill cancer cells, it's a far stretch. Also, when I look up consumer lab to see the quality on the available products in the US market, there's minimum to none because it's a roots. So it can absorb all the heavy metal, pesticides. So make sure the quality is there before you even say this is the ashwagandha that's supposed to help you with stress.
Got it. So Jason, can you share with us your fascinating study that is when you looked at this large database of patients in Taiwan that received traditional therapy for breast cancer, and in that same database, there was another cohort of patients that received the same traditional breast cancer therapy, such as chemotherapies, radiation, and surgery, but that cohort of patients also received traditional Chinese medicine, which included herbs and acupuncture. And I thought your results were fascinating. Can you share that with us?
It's a population-based study coming from Taiwan Health Insurance Research Database. This basically is a very unique database where it's like a national insurance program where patients can not only get their conventional medicine, but they have also the choice of getting traditional Chinese medicine. And when you are diagnosed with cancer in Taiwan, your medical fees are waived completely. So we're not really studying the rich or whoever can get access to these traditional medicines. So all are equal, or at least the bias is minimized. So when we're comparing people who are taking conventional only versus conventional plus traditional Chinese medicine, and we looked into breast cancer prevention and breast cancer survival rates, there's this association of better outcome in the arms where they're combined with conventional and traditional Chinese medicine. It's worth looking into further, and we need to design prospective bigger trials and really answer the question in what specific breast cancer types and what symptom that can be really alleviated with the combination of traditional Chinese medicine.
I do think the Taiwan insurance database provides a great opportunity to look at the real world effect of how traditional Chinese medicine herbs can be combined with conventional cancer treatment. Because in the US, we don't have database like this, right? So a lot of time people who have money, who are highly educated, tend to be able to afford those supplements, herbs. So you're just studying like, well, does rich people have better cancer outcome? The answer we know, yes. But I think the Taiwan database allow us to more clearly understand the benefits of Chinese medicine herbs in the context of cancer care. And that will also inform us to potentially develop a more targeted clinical trials in the United States.
Yeah, I think that's fascinating because you're right. Like the minimizing what we call that selection bias is incredibly powerful. It's almost impossible in the U.S. to do those types of studies by just looking at databases. So I do want to sort of end on the question that a lot of patients end up posing to me, which is why not? Can you talk to us about the concerns that you may have on some of these alternative approaches that folks have? I think the integrative therapies that you've provided and prescribed are clearly thought through carefully as a physician to your patients, but so many patients, they can go on to Amazon and get whatever they want, and they do. So how do you sort of deal with that? And we do, I should state, have the largest supplement database online that patients can look up these therapies and learn about them. But any advice for our patients that just want to try?
Thank you for mentioning the About Herb database, and Jason does a wonderful job managing, together with our other wonderful colleague Jyoti, that really have like over 280 monographs to carefully curate what are the herbs and supplements are, what their intended use, what we know in animal or laboratory setting, and are there any clinical trials and potential herbal drug interaction. So for any patients or families considering using those herbs and supplements during cancer treatment, they should really check on that website before they just trust what's published in the herbal company's website. So to really make sure you are informed and also talk to their doctors. One thing I often tell patients, a lot of herbs and supplements are relatively safe for people without cancer or without health conditions. But for people with cancer, especially in the context of receiving oncological treatment, your liver, your kidney are working incredibly hard to metabolize drugs. And adding a lot of herbs, and some of the herbs even have kidney or liver toxicities. So for a normal liver not challenged, it may be okay, but then in this setting, the risk is just really magnified. Secondarily, a lot of time we just don't know how the herbs will interact with the drug. So you go in with the goal is to help you cancer, but at the end of the day, you may end up hurting yourself. So that's why also you need to be really careful. The third also is many cancer patients nowadays live with advanced cancer for many years. So often, because cancer can cause coagulation issues, so they're on anticoagulant. Some of the herbs may interact with those agents to increase the bleeding risk, especially for GI cancers. So some of those are not trivial. Then when you have a major GI bleed event, it can be really costly to the morbidity, mortality of the patient. So we just have to be careful. So that's why taking herbs and supplements are not such a simple decision for the family and patient to make. Often I would recommend to talk to your doctors and to really have an open mind. I also encourage the doctors and nurses are open-minded. I do think most patients and family really bring this out of their love for the patient, wanting the best for the patient. So we acknowledge where they come from to understand why they're using it and what's it for, and to really negotiate when to use it, when to avoid, rather than just a blank answer. Don't use everything, because the reality, then patient end up probably just going outside, do something without even telling you.
Yeah, I think that's beautifully said. And then lastly, some patients just don't have access to integrative medicine in their community centers or even in some cancer centers. Any advice on where they might go to look for such a resource?
So actually at MSK, our website, we do have about herbs information completely free to the patient. We also have worked with some expert to create a library called the Meditation Library. Have really wonderful guided imagery, meditation, breathing exercise for those patients in the chemo room, waiting for procedure and surgery, and even hospitalized. I think when you feel that stress, anxiety, those are at your fingertip. You can also access. We do have a wonderful integrated medicine at home virtual program. We actually have patients from 23 states and 3 countries enroll in that program. And that is a program people come together to exercise, to do yoga, meditation, participate in music therapy to help to maintain physically active, deal with anxiety and distress, and build that social connectivity to support each other through this journey.
We'll be linking these resources in our show notes so that you have them. Jason and Jun, thank you so much for joining me today.
Thank you.
Thank you so much, Diane.
Thank you for listening to Cancer Straight Talk from Memorial Sloan Kettering Cancer Center. For more information or to send us your questions, please visit us at mskcc.org/podcast. Help others find this helpful resource by rating and reviewing it on Apple Podcasts or wherever you listen. Any products mentioned on this show are not official endorsements by Memorial Sloan Kettering Cancer Center. These episodes are for you, but are not intending to be a medical substitute. Please remember to consult your doctor with any questions you have regarding medical conditions. I'm Dr. Diane Reidy-Lagunes. Onward and upward.